ready to get going. We're going to first go to Senate Bill 2419, and so I'm going to recognize the gentleman from Rankin to handle the bill.
Thank you, Mr. Chairman. This is the medical examiner's bill. It is strictly a repealer bill. The new repealer date will be 2025.
Thank you, Mr. Chairman. Any questions? And what is your motion, gentlemen?
What are we? Title sufficient, do pass, as amended, strike all.
All in favor say aye. All opposed, motion carries. Real quick, and that was strike all of AA, right? Yeah, AA. As amended. All right, next bill, Senate Bill 2420, recognize the lady from Forest. I keep doing that twice. Senate Bill 242, recognize the gentleman from Harrison.
Thank you, Mr. Chairman. 2420, which is amended with the strike all, allows for the issuance of a temporary license for out-of-state social workers and marriage and family therapists. The license valid for 365 days, and the criteria for issuance would require the applicant to undergo a criminal background check, have successfully passed the national exam, be properly credentialed, and be found competent by the board. The practice setting is limited to a nonprofit health or marriage and family therapy facility. And this concludes an explanation of the bill, Mr. Chair.
Thank you. Any questions for the gentleman? In your motion, gentlemen?
Title sufficient, do pass as amended.
All in favor say aye. All opposed, motion carries. Next bill, Senate Bill 2746. I'd like to recognize the gentleman from Jones.
Thank you, Mr. Chairman. This bill is called Hudson's Law, and basically what it is that it requires that once a mother or a pregnant lady has been found to have a Down syndrome child, that the provider, the nurses, anyone that has contact with her is required to give them any type of information, resources, or information that they might have to help take care of the Down syndrome child.
Excuse me, any questions for the gentleman? Gentleman from Hines.
We need a law for that?
Sir?
We need a law for that?
Well, basically what happened was this was a personal friend of one of the senators, and that they ended up having the child, and it had Down syndrome, and there was no information. They did not know where to start, and so this is just going to be a way to help take care of the child better.
Thank you.
Any more questions? What's your motion, gentlemen?
Title sufficient, do pass.
All in favor say aye. All opposed, motion carries. The next bill is Senate Bill 2750. I will say that we were able to add, as y'all know, we had a public health subcommittee yesterday, and we were able to get the question for the gentleman from Washington answered. However, this bill dealing with the pharmacy and our physicians, this will allow a pharmacist to have a specific protocol with a physician, and as long as that physician and that local or that specific pharmacist have a written protocol, then that pharmacist will be able to prescribe medicines based on that protocol to the physician's patients. And so this is just another aspect of healthcare in Mississippi, and you can actually, as many of you know, I've focused a lot on rural health, and this could even be really going toward helping the rural health of Mississippi. So basically, again, it will allow a physician and pharmacist to enter into a specific protocol where that pharmacist can treat certain diagnoses based on that protocol. If the physician's not comfortable with this, that physician will not enter into that agreement. And that is the explanation of the bill, and I'll recognize the gentleman from Jones. apologize. Excuse me, no, we did not. Good question. It will just say practitioner. So as practitioner is defined, and of course, that would be anybody today that can prescribe medicines. Any other questions? Motion is, title sufficient, do pass as amended. All in favor say aye. All opposed, motion carries. Next bill is Senate Bill 2751. Now I'd like to recognize a lady from Forest.
Thank you, Mr. Chairman. Mr. Chairman, this bill is for the State Board of Massage Therapy. It just extends the repealer to 2025. There are a few other changes that we have made. One, it reduces the number of hours of training from 700 to 600, which puts it in line with other states, specifically states in our region of the country. It sets up a registration which includes it's a database that lists locations and ownership of massage therapy businesses. Yesterday, the lady from Jones asked a very good question about some language in here dealing with gathering confidential information. And so I looked into that, and that information had to do with did not address clients of massage therapists. It deals with the practitioners themselves. So it is a database within the industry that if a massage therapist has had a disciplinary action taken against them, they violated had some type of violation, and there was a disciplinary action taken against them, that if somebody is seeking licensure, let's say in another state, because maybe they lost their license in a neighboring state, that the Board of Licensure can see in a confidential database that that individual had problems with in their prior state. And this just is to protect the patients or the clients that come to the massage therapist, and just be sure that they are in good standing. But again, it has nothing to do with keeping confidential information of the clients who go to a massage therapist. And that is my explanation of the bill, Mr. Chairman. Lady from Jones?
Yeah, just to be clear, to make this clear, would the committee just entertain saying that this is only applicable to the practitioners? And that would make it absolutely clear that none of our, at no time would any of the clients.
Just,
I mean, it wouldn't do it any harm. I think it would help to clean it up some.
okay. Chairman says that he's fine with that, and we will make that addition.
Well, we would make the motion for the amendment.
So offer your amendment, lady, or a conceptual amendment, and maybe, Ronnie, maybe the council can help us here. Maybe since it's already implied, I wondered, I think in the past, haven't we sometimes,
Applicable to the practitioner.
it may be an amendment, but then is it already implied that we can just make it a little more specific?
Talk about concepts, but look at the language, y'all. It says the board shall share documents, including confidential information, with information received by the board with other state or federal agencies and with a national database. So how do we make it the practitioner? The practitioner's not involved at all now.
No, I was saying that the content that was shared would be from the practitioners. That's what the lady from Forest County explained. She said that the content, these documents, materials, the confidential information, the privileged documents, that all of those things would only be applicable to the massage therapist. And I just thought that to make that crystal clear, that those would be the documents shared. But if it's gonna,
What?
be,
Oh,
if you think it's okay.
No, I'm just saying that these are records that the board has on those people, right?
I don't know. See, that's what I'm saying. I don't know if it's saying that these are the records exclusively to the people. I don't know. But if you're saying that it is, I trust you. So
Well-
I withdraw my amendment.
Yeah, I mean, if you look on line 99, the board shall share the documents with another state or federal agency or a national database, so it'd be the records of the Massage Therapy Board, not, the practitioner not really involved there directly.
But just
Well,
so
I mean,
we
they
know,
are,
it's the-
it's their records, but it's records
Yes.
on them that are held by the board, you see?
Okay. I withdraw my amendment.
Thank you. I understand what you're saying, lady, but I think what you're wanting is in this legislation, so it will be safe. And so I know what you're saying, and we don't want that material shared as well. So you're withdrawing your amendment?
Yes.
Okay. Any other questions? All in favor say aye. All opposed, motion carries. Thank you. Last bill is Senate Bill 2759. This is the legislation that we passed yesterday in subcommittee that will raise the TANF benefits from $110 to $200. As you may have seen in the press, Bob Anderson, who's the new director of DHS, believes we have the money, knows that we have the money to do this. It will cost $2.8 million. And so that is our request today to go from 110 to 200. Yesterday in subcommittee, the lady from Jones made two amendments that they are now incorporated in your strike-all amendment to make sure that they will send us a report on two sections of the bill, and so that is in this legislation today. Any questions about this legislation, Senate Bill 2759? Lady from Jones.
And so, Mr. Chairman, on line 530, so that the agency, because I know they're listening, that the Department of Human Services will understand, there is no necessary federal waiver. There is no site for approval. What they were supposed to have been doing was getting people off of welfare and back to work all of these 30 years that this bill has been passed. And what we were saying is once they make an assessment of the people's abilities, then they could look through all of state government to see if there was a place that person could be referred. You can't make them hire them. But what this would have done was given these people a referral. Everybody that's on TANF is not have a GED. You have people that things have happened in their lives. They're college graduates, things have just happened. And so this, if the Department of Human Services had been doing this, I'm not talking about this guy. I mean, they hadn't done it, over the years. So I just wanted the committee to understand why we're asking for the report, because I think we all want to see people go to self-sufficiency, right?
Yes, ma'am, and that is why, after your explanation yesterday, we added, and DHS is aware of it, and they will follow this legislation.
And I thank the chairman. I think that this will get them moving now.
Yes, ma'am. Thank you. Any other questions? Motion is title sufficient, do pass as amended. All in favor say aye. All opposed, motion carries. Thank you all for coming, and I appreciate it.